Hi, everyone. My name's Andrew Toy. I have Loeys-Dietz type 4. I also have a Marfan, a fibrillin mutation. So I also have, we don't think it's pathological, but I'm also in the Marfan category. And for the longest time, I was actually diagnosed and managed as Marfan. My father unfortunately dissected when I was 17, and he never received a diagnosis. It was only when he later passed away 5 years later, when I was in my early 20s, that people thought, wow, I wonder what caused that. And he didn't look Marfanoid, and so he never got diagnosed with Marfan, but they tested my genetics, found a fibrillin mutation. And so I was diagnosed with Marfan, and I started beta blockers and management. And I've been well managed for a number of years. Much later, we just did another genetic test just to see, and I carried another mutation, the TGF beta 2 mutation, which is when I was moved to Loeys-Dietz, and my management actually changed. Instead of just an echo every year, which is for Marfan, I do the full body MRAs, which many Loeys-Dietz patients, many of you probably do. So what I actually think about with Loeys-Dietz, with Marfan, is how important early diagnosis is. It's something that's really burned in my brain because my father never had the opportunity, was not fortunate enough to have somebody identify before him that he might be at risk. I had that. My brother, who has Loeys-Dietz as well, had that because my father dissected twice, and then we were identified and we were managed. And so the way I think about it is, what if we lived in a world where we could get that done for everybody, right? There's so many people who are underdiagnosed or not diagnosed right now. It's so hard to get a diagnosis. Um, and so I've really taken my computer science expertise. I'm a computer scientist. I've always loved computers. My early career was in just regular technology. And now I'm in healthcare. I moved into healthcare when I was a few years ago. I focus on the Medicare population, and I'm just absolutely focused on building technology that will identify and manage chronic disease, not just Loeys-Dietz, but like all chronic diseases can be greatly mitigated if you identify the condition and start management as early as possible. And so that's what I talk about a lot. I talk about it in healthcare. I use my Loeys-Dietz, I use my Marfan example. Like, there's a double diagnosis, right? Because even though I was diagnosed with Marfan after my father dissected, I wasn't diagnosed with Loeys-Dietz until much later, and maybe I needed those full body MRAs. Um, and so that management started later, so I'm really passionate about taking that experience, looking at this world we're going into with AI, with data. I work on this every day. I'm on the board of the foundation, and really my mission is to say, not just to take my experience with these connective tissue disorders, look at the whole world and look at all chronic diseases and say, what if we could identify those as early as possible, manage them as early as possible? We can save lives, we can change lives. And I think I'm not sure I would necessarily have done that if I didn't have Marfan and Loeys-Dietz. So it's always part of me. It will forever be part of me, obviously. And it's really changed who I am. Thanks.